Hello, and welcome back to Skin Deep Wellness Chronicles. I'm your host, Dr. LaKimberly, your board-certified dermatologist here to help you navigate the world of skin health and wellness. Today we're diving into two common yet often misunderstood skin conditions, eczema and psoriasis. If you or someone you know is struggling with one of these conditions, you know how challenging it can be to manage the flare-ups and the daily discomfort. In this episode, we'll explore what causes these conditions, the triggers behind flare-ups, and the best strategies for immediate relief and long-term care. Let's jump right in. Let's start with a quick breakdown of what eczema and psoriasis are. Eczema, also known as atopic dermatitis, is a condition that makes your skin dry, red, and itchy. It's common in children, but can happen to anyone at any age. Eczema often flares up in response to environmental factors, like changes in weather, exposure to allergens, or even stress. On the other hand, psoriasis is considered more of an autoimmune condition that causes your skin cells to turn over faster than normal. This leads to thick, scaly patches or plaques that can be itchy, painful, and sometimes even crack or bleed. Psoriasis can show up almost anywhere on the body, including the scalp, elbows, knees, and nails. The tricky part, both of these conditions tend to flare up when you least expect it, and while they can't be cured, they can be managed effectively. So what exactly causes these flare-ups? Let's talk about some common triggers. For eczema, environmental factors play a huge role. This can include cold, dry air in the winter, harsh soaps or detergents, stress, and even allergens like dust mites or pet dander. If you're dealing with psoriasis, some of your triggers might overlap, but things like infections, skin injuries, even minor ones like a cut or a sunburn, and certain medications can lead to flare-ups, as well as stress. Knowing what triggers your skin is key to managing both conditions. A tip I give all of my patients is to start a trigger journal. Write down when your skin flares up and what's happening around that time. Were you under stress? Did you switch laundry soaps? Are you traveling? By pinpointing your personal triggers, you can take action to avoid them as much as possible. Now let's talk about flare-ups. If you're experiencing an eczema or psoriasis flare, it can be very uncomfortable and even painful. Please know there are ways to calm your skin down quickly. For eczema, number 1, moisturize, moisturize, moisturize. I can't stress this enough. When eczema flares up, your skin barrier is compromised. Using thick creams or ointments, especially ones with ceramides, can help restore the barrier and soothe the dry patches. Number 2, steroid cream. For mild flare-ups, over-the-counter hydrocortisone cream can help reduce redness and itching. For more severe cases, your dermatologist can prescribe stronger topical steroids. There are also many steroid-free options that can be prescribed as well. Number 3, avoid hot showers. Hot water strips the skin of natural oils, making eczema worse. Stick to lukewarm water and limit shower time to 10 to 15 minutes. For psoriasis, number 1, again, keep your skin moisturized. Just like with eczema, moisturizing is key. Thick creams or ointments help lock in the moisture and soften those scaly patches. Number 2, topical treatments. Prescription creams that are steroid or steroid-free, things like a vitamin D analog, even salicylic acid can help slow down skin cell turnover and reduce scaling. Number 3, systemic treatment, such as pills by mouth or even injections, are often prescribed. One of the most important things to remember during a flare-up is not to scratch. I know it's tough, but scratching makes all of the conditions worse and can lead to more risk for infection. While managing flare-ups is important, what can we do for long-term control? Both eczema and psoriasis require ongoing care because we cannot cure them, but we can definitely get them under better control. For eczema, building a daily routine that includes moisturizing at least twice a day to keep your skin hydrated, using gentle, fragrance-free products that won't irritate the skin, taking shorter, cooler showers can help you prevent flare-ups before they start. For psoriasis, long-term management might include regular dermatology visits to monitor your condition, topical treatments, and for some, systemic medications like biologics or oral treatments that target the immune system. In addition, both conditions respond well to stress management. Whether it's yoga, meditation, or even just taking time for yourself, reducing stress can make a big difference in your skin's health. Finally, let's touch on lifestyle. Many people with eczema and psoriasis find that certain foods or lifestyle choices can affect their skin. While there's no one-size-fits-all answer, some studies suggest that reducing inflammatory foods like processed sugar or dairy could potentially help reduce flare-ups. Maintaining a healthy lifestyle, staying active, and eating a balanced diet rich in anti-inflammatory foods like fish, dark green leafy greens, and fruits can help support your skin health from the inside out. Taking control of your skin health. So, to wrap things up, while eczema and psoriasis can be frustrating, there are plenty of ways to manage flare-ups and keep your skin as healthy as possible. Identifying triggers, maintaining a solid skincare routine, and managing stress are all crucial steps in keeping those conditions under control. Thank you for joining me today on Skin Deep Wellness Chronicles. I'm Dr. Kimberly, and I hope these tips help you feel more empowered in managing your eczema or psoriasis. Remember, taking control of your skin health is a journey, but with the right strategies, it's absolutely achievable. Until next time, take care of your skin, be well, and stay well.